Seat.
Do you have a roaming microphone we can use?
A very good morning to one and all. I guess our delegates are joining us. Yesterday at the same time, the hall was completely full. So we were just waiting for them to come in. I'm Vamsi, the president of HIMSS India, and I just wanted to mention about, yesterday we were expecting Dr. Devi Shetty, the chairman of Narayana Health, to deliver the inaugural keynote. Unfortunately, Dr. Devi Shetty has been taken very ill, and we initially thought maybe he'll join us on a video conference. Unfortunately, he could not even do that. Thankfully, he is recovering, but we're very sorry that yesterday you could not get an opportunity to hear Dr. Devi Shetty and his amazing vision. Also, we, because of how the government runs, and so we were supposed to have the Health and Family Welfare Minister, Shri J.P. Nadda Sahab, here yesterday. Unfortunately, because of a cabinet meeting, he could not join, and we were joined by the Minister of State. So I just wanted to mention that we're sorry for the change yesterday, but some of these things are not in our hands, and thank you so much for your understanding. Kripa.
Welcome to Day 2, HIMSS Digital India Health Summit. A warm welcome to all our panelists and our chair. Requesting Mr. Mark Landry, the session chair, advisor WHO. Panelists, Mr. Nikunj Udhal, Joint Secretary, MOHFW, Government of India. Dr. Ashok Kumar, Additional DGHS, Government of India. Dr. Balaji, CMIO, HCG Oncology. Dr. Prabhat Ranjan, Executive Director, TFAC. Mr. Krishan Giridhar, MD, Presto. Mr. Anil Bajpai, Co-founder and CTO, PMHLC. Dr. Suprendra Nath, Project Director, Center for Health Informatics, Government of India. These are our esteemed panelists for the day, and the session is on digital health. Mark Landry, Mr. Mark Landry, over to you.
Fantastic, thank you. Welcome everyone this morning. I guess apologies, of course, for the traffic outside. We hope that our audience will grow through the course of this morning. Again, I'm Mark Landry. I'm with the WHO and just recently joined the Southeast Asia Regional Office here in New Delhi. It's my pleasure to moderate this panel this morning. We have quite a distinguished panel, and due to the delay in getting started, we are going to extend a little bit this morning, but each of the sessions throughout the day will be a little bit compressed. But I wanted to begin by expressing that I hope this morning we will see quite a diverse range of inputs, both from government, from the private sector, looking at digital health solutions and issues around scalability, sustainability, public-private partnerships, standardization and interoperability, and so forth. Without further ado, I would be pleased to introduce Mr. Nikunj Udhal, the Joint Secretary from the Ministry of Health and Family Welfare, who will lead off by giving us some introductory remarks regarding the Ministry's efforts to implement and utilize effective e-health solutions here in India. Mr. Udhal, if you will, we invite you to the podium and share your remarks. Thank you so much.
Good morning to all of you. In fact, it is my privilege to be the first speaker. I thank HIMSS for inviting me for this conference, which is, I think, a very important one, considering that a lot of talk is happening around e-health these days. And there is I would like to say, there is a fair degree of uh, political commitment at the highest level of the union government, that I can tell you. But then at the same time, let me also caution you that uh, it will take some time for that commitment to percolate down to the states, even to the bureaucracy. Uh, what is happening in health sector, it is not that ICT is not being used in health sector, it is being used in the public sector as well as in the private sector. But then those applications have been in silos, those applications are not interoperable, are not standardized. So this is what we realized in the ministry some time ago. I have two colleagues from the health ministry also, the additional director general health services in the DGHS, Dr. Ashok Kumar, and then Professor Supten Sarvadhikari from the National Health Portal. So they will be speaking about some of the things which I would miss. So the first step we took was to notify the EHR standards, electronic health record standards. That happened almost 2 years ago. And then we are now basically revisiting those standards. A committee has been constituted again, because the standards are living documents. Standards are not basically things which are etched on the stone and then remain so forever. Technology is changing very fast. Our understanding of the e-health ecosystem is also changing very fast. Those standards must evolve. And then we realized that there is a need for providing leadership by the government in adoption of e-health standards. So we are basically proposing to establish a national e-health authority, basically for promotion of the standards, then updation of the standards on a continuous basis, and maybe to design and enforce certain protocols for sharing of the EHR of patients across facilities. But then there is also an associated issue that is regarding the privacy and the security of the electronic health records, because this is my record, this is your record. And we realize that we need to come up with a regulation. So we are working on a legislation basically to address these issues. And we have written to 4 institutes of national repute, including National Law University, Bangalore, IIT Kharagpur, to basically help us in drafting the legislation. And then we also realized that government alone can do very little. We need to take everybody along with us. We need to take the private sector, we need to take the developers, we need to take the research community, and there has to be an ecosystem. So we are establishing the Indian Health Information Network, where basically the government is working like a glue. And let me tell you, the basic objective of all these things is that we must promote standardization of health information systems across the public and the private spectrum. But then, let me tell you very honestly, even arranging adequate funding for rolling out EHR in all public hospitals is a big challenge as of now. People realize that, okay, this is something good, we must be doing it, but then when it comes to the finances, there are people actually who tell, okay, why don't you look for this, why don't you look for that, and why don't you ask the states to invest? Because now basically people feel that the states have got greater devolution of funding through the finance commission mechanism. So you just be a facilitator, and then you ask the states to put in the bucks. So that is Basically, that is one way of thinking. Then some people tell, why don't you work with the private sector in a public-private partnership mode? Actually, implementation issues really need to be resolved quickly, but then we want to move ahead. The other issue basically is adaptation. Because you see, standards are okay, products are okay, platform is okay, but then you need people to adopt those standards, be it in the private sector or the public sector. And you see, I saw the adoption of the EHR by some of the general practice surgeries. They call, though these are the OP centers, but they call them the GP surgeries in the United Kingdom. I recently visited 2 such GP surgeries in eastern part of London, and I was quite impressed to see the kind of adaptation that has happened at the GP level. And I was told that the hospitals in UK are living in the Stone Age. They are still managing with the paper records, whereas the GPs, they are in the IT age. But then everybody in the world also recognizes that India has the potential to do this. We are a IT superpower. If nobody denies this fact. If we tell we are going to be a world research in biotechnology research or maybe drugs research, people will not take us very seriously. That is my feeling. If we take we are going to be a world leader in biomedical devices, people will tell, okay, India is coming up, but then they will take time. But when we tell that we are going to do something really very fundamental and also transformative in the use of IT in health sector, none in the world would really question us. That is my feeling. So people have faith in our abilities, and there is a commitment at the highest level of the political establishment to do something in e-health. But then, as I told, we need to really tie up the funding. We need to see through the implementation mechanism from the perspective of sustainability. And then we need to work as a complete ecosystem for promotion of e-health in the country. And I don't need to reiterate any of the topics you must have discussed yesterday regarding the benefits that will accrue to the providers, that would accrue to the patients, as far as adoption of e-health solution is concerned. So I think I would like to stop it here, and maybe while we discuss, I may take some questions. Thank you.
Thank you very, very much, Mr. Dahl, for framing some of the key issues and some of the priorities and focus, recognizing that scalability and sustainability is challenging, but not something that can't be overcome. One of the issues that our next speaker will address, Dr. Ashok Kumar, the additional DG for Health in the Ministry of Health and Family Welfare, will, in his role with the Bureau of Indian Standards and chair of the Health Informatics Committee, we'll discuss some of the standardization and standards that are being implemented already, and how this might improve some of the interoperability that is needed for scale. Thank you, Dr. Kumar.
Mr. Chairman, my co-panelists, Mr. Rajendra Pratap, all the distinguished members of this august house. My privilege to be the part of this house, and at the outset, I really bring the greetings from the Directorate General of Health Services, the Ministry of Health and Family Welfare, Government of India. Now, in this particular 5 to 6 minutes, I have been assigned the duty to make you aware and the contributions of the Bureau of Indian Standard in the Government of India. and I'm really privileged that I am the chairman of the Health Informatics Committee in the Bureau. And I'd like to go through in a very brief what the Bureau is and what contribution it's making, and finally, as far as health and the health electronic records are concerned. Well, we all know that Bureau of Indian Standard is a national standard body of India, which is very much concerned about the standardization, certification, and the quality. On 6th January 1947, it was established as Indian Standard Institution, ISI. And that is still our logo of the quality. Whenever the Bureau approves, this sign comes in the product. Under the Bureau of Indian Standard Act 1986 of the Parliament, on 1st April 1987, the ISI was upgraded to the Bureau of Indian Standard as an autonomous body under the Union Ministry of Consumer Affairs, Food and the Public Distribution. The main functions of this Bureau is to establish, publish, and promote the Indian standards in relation to any article or process, and also to grant, review, and if need be, suspend, even cancel the license for the use of standard mark. So this is in a nutshell a very big mandate for this Bureau. The Bureau has 14 division councils for the standards, virtually every aspect, whatever we use in our country. I'm not going into the detail. Let me focus myself on the medical and the hospital. And this is a one big division called Medical Equipment and Hospital Planning Division under the chairmanship of Dr. S.P. Agarwal, who is the former Director General of Health Services in the Government of India. At the moment, he is the Secretary General, Indian Red Cross Society. Now, this particular MHDC has got 19 committees, and I've indicated in this slide what are the standards are being looked into: medical equipment, surgical dressings, artificial limbs, rehabilitation equipments and diagnostic, veterinary surgery, dental equipments, laboratory equipments, water purification system, hospital biomedical waste management, infection control, medical biotechnology, medical nanotechnology, hospital planning and healthcare services, and health informatics. It's a wide range of standards are looked into by this council. Well, under this is the Health Informatics Committee, and which was established in 2007. It started, and this is the 17th committee in the Bureau, and I am privileged to be its chairman from 2011. Now, this particular Health Information or Health Informatics Committee looks into the standardization in the field of health information, communication technology, in order to achieve a compatibility and interoperability between the independent systems working in the country, and also the data for comparative statistical purposes, for example, classification, and also to reduce duplication of efforts and redundancies in the country. To brief on this Health Informatics Committee, till now we have already published 11 standards. Currently, the 10 standards are under wide circulation, and the remaining 21 standards are under preparation for their circulation. So besides this 11, I'm going to hold the meeting next month, wherein all those 10 standards under circulation will be looking. So maybe by September, our standards publication will be going to 21. Here, I also summarize through this slide that we have already published standards on the digital imaging, communication, electronic health records on various aspects of it. We have gone into vocabulary for terminological systems. We have gone into the requirements for the electronic health record architecture, health cards, general and the specific issues, interoperability of the telehealth systems and networks, and the personal health devices like pulse oximeter and Communication. Also down below, these are some of the standards for which the publication circulation is already going on and will be taking up in the recent near future. So we are definitely moving it. This entire committee is having almost 46 members drawn from various institutions and specializations from all over the country, including government, nursing, everybody, including the private sector. And this particular Bureau of Indian Standard, it really goes and works in close coordination with the government and various other institutions. I'm also recently been appointed as the chairman for the steering group and the facilitation for another standards compliance for the electronic health records under the Ministry of Information and Communication. So all of us are working together. In the ministry, you've already heard the Joint Secretary that the standards, again, the center is coming. So thank you very much, and I wish you the compliments for our coming Independence Day. Jai Hind.
Thank you very, very much, Dr. Kumar. Certainly we understand the importance of standards, the mandate, but also what the progress has been made already and what to look forward into the future. Our next speaker is Dr.